Hi, I'm Dr. Duberry.
And I'm Dr. Cody Grigsby.
And today we're going to present you how to use an exercise at home if you have a lumbar anterior spondylolisthesis.
Anterior spondylolisthesis is a mouthful, and it's kind of a barbaric name. But what exactly does that mean?
Anterior is anterior, spondylo means vertebrae, and listhesis displacement. In summary, it's a displacement of a lumbar vertebrae anterior in relation to the sacrum. It can be at the fifth lumbar or the fourth lumbar, the most common.
And this happens a lot with people, and those are the most common levels. But to really know if you have this condition, you must first see your medical professional, chiropractor, physical therapist, get an x-ray, a lateral x-ray of the lumbar spine if you're having discomfort and a reason to have that. And then you may have this condition.
And very often we will also add a flexion extension to see the stability of that spondylolisthesis. And if it's unstable, we may decide to not treat it. But so we advise you to consult with your treating physician and proceed to the exercise that you're going to see together. And as usual, as like all home exercise, if you feel better, less pain, higher flexibility after the treatment, great. But if you don't feel good after the treatment, what do you do, Dr. Cody?
You're going to stop.
You stop. All right? So what do we do? If it doesn't work,
you stop.
We stop. All right? So remember that. Now, we're going to proceed. So what do you need? You need a chair. Here we have a big yellow block. You need a little mat. We need 2 towels and maybe a pillow. And that's about it. All right, so we're going to go. Dr. Cody, you're going to put, so he's going to put 2 feet, his 2 feet on the chair. His toes is going to be up. And here we're going to have a 90-degree angulation with the knee and with the hip. And I'm going to ask him to bring his pelvis up, and under his pelvis I place 2 towels, 2 or 3. You want his pelvis up, and the level of the belt is usually the tip of the ilium, that big flat bone that we have. So we don't want the towel to go above the belt. It has to stay below it. So here I can place my hand under his lumbar while not touching the ground. So we have basically what we call a nudation of the pelvis. We're opening up the posterior part between the L4, L5 vertebrae, so it goes backward. And now we want to create a tension. So to create a better tension, we're going to, that's it. So as he has his head slightly bent, we have via flexion, a tension that goes all the way down to the junction between the lumbar and the sacrum where we have the problem. Now, we're pretty much ready. So we can stay there and absolutely do nothing, just let the gravity work for us. We will do that a little later on, but now we're going to promote more motion. And Dr. Cody, you're going to contract with your lower abs. Go ahead. And he's going to come up 20 degrees. Go ahead. Beautiful. Relax. Again. Beautiful. And you're going to do that a set of 10. You relax, another set of 10. And you can space it. And if you have an acute lumbar crisis, like it may happen with those conditions, you may want to test, get up, and see how you feel. Always test yourself. Now, if you're a little lazy and you have some time, just take a National Geographic and spend a good half hour reading it in this position. And your back will do the healing on its own.